Hi, it's Annie. Welcome to my YouTube channel Annie Freedo, where I teach 3D anatomy. In this video, we are going to discuss the pericardium with the high-yield gross anatomy, specifically themes of the USMLE Step 1. What's interesting here is that I will show you all the structures on 3D anatomy with complete anatomy by Elsevier. Let's begin. The pericardium consists of three layers: visceral layer of serous pericardium, parietal layer of serous pericardium, and the fibrous pericardium. The visceral layer of serous pericardium is known histologically as the epicardium and consists of a layer of simple squamous epithelium called mesothelium. Beneath the mesothelium, coronary arteries, coronary veins, and the nerves travel along the surface of the heart in a thin collagen bed. Adipose tissue is also present. At the base of the aorta and the pulmonary trunk, the mesothelium of the visceral layer of the serous pericardium is reflected and becomes continuous with the parietal layer of serous pericardium, such that the parietal layer of serous pericardium also consists of a layer of a simple squamous epithelium called mesothelium. The pericardial cavity lies between the visceral layer and the parietal layer of serous pericardium. Normally contains a small amount of pericardial fluid, which allows friction-free movement of the heart during diastole and the systole. Transverse sinus is a recess of the pericardial cavity. After the pericardial sac is opened, and surgeon can pass a finger posterior to the aorta and the pulmonary trunk, and anterior to the superior vena cava, from one side of the heart to the other through the transverse sinus. The oblique sinus is a recess of the pericardial cavity that ends in a cul-de-sac surrounded by the pulmonary veins. Fibrous pericardium is a thick collagen layer, no elastic fibers, with limited ability to distend acutely. The fibrous pericardium fuses superiorly to the tunica adventitia of great vessels, inferiorly to the central tendon of the diaphragm, and anteriorly to the sternum. The phrenic nerve and the pericardiaco-phrenic artery descend through the mediastinum lateral to the fibrous pericardium and are in jeopardy during the surgery to the heart. Cardiac tamponade, heart compression, is the accumulation of fluid within the pericardial cavity, resulting in compression of the heart since the fibrous pericardium is inelastic. Clinical findings include hypotension that does not respond to rehydration, compression of the superior vena cava, which may cause the veins of the face and neck to engorge with blood, a distension of veins of the neck on inspiration, Kussmaul sign. Cardiac tamponade can quickly progress to cardiogenic shock and death. Pericardiocentesis is the removal of fluid from the pericardial cavity, which can be approached in two ways: sternal approach. A needle is inserted at the intercostal space 5 or 6 on the left side near the sternum. The cardiac notch of the left lung leaves the fibrous pericardium exposed at this site. Needle penetrates the following structures: skin, superficial fascia, pectoralis major muscle, external intercostal membrane, internal intercostal muscle, transverse thoracic muscle, fibrous pericardium, and the parietal layer of serous pericardium. The internal thoracic artery, coronary arteries, and pleura may be damaged during this approach. Subxiphoid approach. The needle is inserted at the left infrasternal angle, angled in a superior and posterior position. The needle penetrates the following structures: skin, superficial fascia, anterior rectus sheath, rectus abdominis muscle, transverse abdominis muscle, fibrous pericardium, and parietal layer of serous pericardium. By the way, the diaphragm and the liver may be damaged during this approach. Thanks for watching. Share your ideas for the next video in the comments below, and don't forget to subscribe and connect with me on TikTok and Instagram any free do. Looking forward to seeing you there.